So this is Joe. He's our 5-year-old male patient presenting with 2 to 3 day history of non-bilious and non-bloody vomiting. The vomiting Mom described as happening multiple times throughout the day. She said it wasn't green or red, and it happened every time he was eating, and he would kind of vomit what he had just eaten prior to that. Mom also said that he had a couple of loose stools a few days ago, and he did have one this morning. And she said that she felt tactile temperatures, but that she never actually measured his temperature. Other pertinent symptoms is that he has a little bit of abdominal pain, and he hasn't been as active as usual, a little bit of lethargy. A couple of weeks ago, he did have a cold with a running nose and a cough, and he does have a history of allergic rhinitis, and he does have asthma, and has a big family history of asthma. Positive for sick contacts. Mom says that he attends daycare, and a couple of other kids have been absent, and Mom assumes that they kind of have the same thing. And then on review of systems, he was negative for any headache or current cough, any shortness of breath, and also no joint pain. His immunizations are all up to date, and his asthma he's not on any controller medications, but he does use albuterol about once per month whenever he needs to. Current medications include Zyrtec, and as I mentioned, the albuterol PRN. He has no known drug allergies. In terms of social history, he lives at home with his 8-year-old sister, and he attends daycare. Nobody in the family smokes, and he lives with his mom as well. Upon physical exam, his vital signs, temperature was 37, heart rate was 120, blood pressure was 98 over 50, which is a little low, and respiratory rate was 20. So he's afebrile. In general, when I saw the patient, he was alert, he was in no acute distress. But I did notice that on HEENT exam that he had swollen nasal turbinates, and he had a couple of lymph nodes in the posterior aspect of his neck. Lungs were cleared to auscultation bilaterally, no wheezes, no labored respirations, and cardiovascular exam showed normal rhythm, normal S1, normal S2, and there actually was a 2/4 systolic ejection murmur that was heard. His abdomen was diffuse and tender to palpation, and I did hear hyperactive bowel sounds in all 4 quadrants, but there was no hepatosplenomegaly, and there were no masses palpated. Capillary refill was 3 seconds. There were no rashes noted on the patient. Neuro exam was all normal. The cranial nerves 2 to 12 were intact. No deficits noted. Strength was fine. In MSK, he had full range of motion in all of his joints and bilateral upper and lower extremities. Genitalia, tanner stage 1, he was uncircumcised, and his testes were both descended bilaterally, and no hernias were found. So just in summary, Joe is our 5-year-old male patient who presented with 2 to 3 day history of non-bloody, non-bilious vomiting, as well as some diarrhea and abdominal pain. So right now, since the patient actually did appear a little dehydrated and his lips seemed a little dry and cracked, we want to go ahead and start fluids to make sure that he's hydrated, and he's been having the vomiting and not really had good PO intake. So starting fluids would probably be best at the moment. And then in terms of his GI, since he does have the vomiting, diarrhea, and the abdominal pain, since it's been about 2 to 3 days, the most likely cause is probably gastroenteritis, since the patient does attend daycare. If it persists and kind of keeps going, maybe getting a stool culture, trying to rule out some other possibilities would probably be best. And that's it.
Great, thanks.